Hello, everyone. Thank you for joining us. This is Alexandra Kamesis from Health 2.0, and I'd like to welcome you to the A Bill You Can Understand Design and Innovation Challenge webinar. Joining me today is Sarika Kasaraneni and Ben Shannon from the U.S. Department of Health and Human Services, Greg Myers from Integris Health, Barbara M. Tapscott from Geisinger Health System, and Amy Cueva and Paul Kahn from MadPow. In today's program, we will walk you through the A Bill You Can Understand Design and Innovation Challenge, including a background, high-level goals, current medical billing process, resources available to participants, and an overview of challenge logistics. We'll then open up the webinar to questions from participants, so please type your questions into the GoToWebinar control panel question window throughout the presentation. We will be making the slides and the recorded presentation available on the challenge website, www.abillYouCanUnderstand.com. And with that, I'll pass it to Amy, who will share more information on the challenge sponsor.
Hi, everyone. This is Amy Cueva with MadPow. We are so honored to have AARP sponsoring this challenge. AARP feels that medical billing and the experience associated is a serious pain point for aging Americans and their caregivers, and wants to stimulate innovation in this realm, and we're able to do that thanks to their sponsorship. And they see great opportunities to improve this process and really help reduce frustration that their constituents see, again, and the people who care for them. So they wanted to thank everyone for participating in the challenge.
Thanks, Amy. Now we'll move over to HHS with Sarika and Ben.
Hi, everyone. Thanks for your time today. At HHS, we're working to transform our healthcare system into one that delivers better care, smarter spending, healthier people, and puts individuals at the center. And based on what we understand healthcare consumers want and where their current pain points are, putting individuals at the center means engaging and empowering them to take ownership of their health by giving them the tools they need to navigate the healthcare system, making price and quality information more accessible, and listening to the patient voice. The complexity of and confusion with medical billing is a real consumer pain point with the healthcare system. Patients today are struggling to understand their medical bills and the billing process. They're often receiving many bills from multiple sources that vary in content and use of healthcare jargon, and it's difficult for consumers to know whether their bills are accurate or complete, or even what to figure out what they owe versus what their insurance plan is going to cover. So medical billing should instead embody each of these healthcare consumer priorities that we've outlined. Next slide, Alex. To that end, we're pursuing a national challenge to bring new and diverse players to the table to build upon the progress made to date within the healthcare system and to help solve this consumer pain point in a way that enables private sector collaboration. The challenge has two objectives: redesigning the medical bill, so improving the bill itself and making it more readable and easier for consumers to understand, as well as redesigning the medical billing process from the patient perspective. And our goals in setting these objectives is that the challenge will catalyze new innovative ideas to make medical billing easier for consumers to understand and navigate, providing a vehicle for these ideas to be tested in the real world, and serve to highlight efforts and best practices in this space, building upon, as I've mentioned, the progress made and opportunities that remain to simplify medical billing.
Thanks, Sarika. We'll pass it over to Greg Myers from Integris Health now.
Good afternoon, everybody. I just wanted to tell you how excited and honored we are to be part of the challenge. Integris is going to be serving in an advisory role. And as such, we are, as you can see, the largest health system in the state of Oklahoma. Annually, we send out somewhere in the neighborhood of over 2 million patient statements. 70% of the population in the state of Oklahoma lives within a 30-mile distance of one of our facilities. And the reason I mention that is we see a hugely diverse and sophisticated demographic patient base that we serve. And it was in that context that we started on a journey to try and improve our billing process to try and be able to reach folks throughout the state of Oklahoma. We have about 2 years into a journey where we are creating a central billing office for all of our hospital and physicians throughout the state, and recently completed the consolidation of 6 different billing systems into a new single platform, that with the endpoint being generating a consolidated patient statement. And this was a year-long process that was driven by a series of focus groups made up of current and former patients throughout the state of Oklahoma who had recently utilized the hospital or physician service. Next slide, please. And I tell you, that process was really intriguing because we quickly realized that the way we as providers take a look at the billing process was drastically different than the patients that we serve. The first thing that popped out was the fact that we really didn't have a retail mindset, and a lot of the feedback that we got from our patients is we really don't understand the bills that we're seeing. As providers, we're used to sending out bills to insurance companies using all the nomenclature that goes along with making sure that patient balances are paid and hospital balances are paid. But now our focus has to change, and we find ourselves having to serve thousands of customers on an individual basis, which is a huge mind shift change for us. And we really need a retail mindset to be able to do that. Feedback we got from consumers really drove home the fact that they are confused. They want to see one single bill. They're tired of getting surprise bills. And more importantly, they want different options to be able to pay the bill. And again, this drove home the point that we needed to become much more retail focused in our billing process. The other thing that really stood out to us was they simply didn't understand the terminology and the language in the bills, and we were encouraged to really work hard to send out bills that were written at a 7th, 8th, 9th grade level so folks could really easily understand the wording on it. So we hope by participating in this, we're excited to see the outcome of the challenge, and we hope that the winning entry and entries can develop not only a patient statement but a billing process that's really driven through the eyes of our patients, our consumers, and more importantly, one that can be easily replicated by health systems and hospitals all throughout the United States, because that is a challenge. We have far too many folks with legacy health systems resistant to change, and we think this is a groundbreaking opportunity to change the system as we've all known it for many, many years. Next slide.
Thanks, Greg. Now we'll pass it on to Barbara from Geisinger Health System.
Good afternoon. This is Barbara Tapscott with Geisinger Health System. We are honored and delighted to participate in this channel as in an advisory role. And as Integris and HHS and others, we are looking forward to the outcome of all the entries. Who we are at Geisinger, we're an integrated delivery system located in central headquarters, I should say, in central Pennsylvania, operating in Pennsylvania and New Jersey with the acquisition of Atlantic Care Health System in October of 2015. Our organization consists of 8 hospital platforms, a physician group practice that includes about 1,300 employed physicians, and a mix of advanced practitioners and teaching programs as well. And added to that, we have an insurance company, the Geisinger Health Plan. And we call our sweet spot the area where we look for innovative approaches to the delivery of healthcare or to the administrative side of healthcare, is in that section or cross-section of the population that receives care from a Geisinger provider at a Geisinger hospital, and it is also covered by Geisinger Health Plan. Speaking of our size, we serve approximately 3.4 million outpatient visits a year and more than 130,000 inpatient admissions. So we cover a large footprint in central and northeast Pennsylvania as well as in the state of New Jersey. Next slide, please. In this slide, we've just tried to depict again our journey towards a combined patient statement. We achieved that in 2005, but many of the areas that we required to inform that patient statement are notated here, starting with the HFMA patient-friendly billing practices. That actually set the standard and the infrastructure, looking for, again, what does the consumer want and what can we do, the healthcare industry, to put the consumer in control and giving them the tools and the documents so they can understand what they're paying for, which is not easy to understand, and everyone has very varied nomenclature for this. In this slide, you will also see how we've expanded to multi-channel patient communication options, where they can actually contact their physician or any administrator through the My Geisinger patient portal. We are also expanding into mobile applications with the Geisinger app. And with My Estimate, we're looking at price transparency. The challenge with price transparency that we've learned here is the basic misunderstanding there still exists in the industry, where price of a gross charge and what the patient actually pays is more driven on their insurance coverage and the status of their employer or their insurance provider with the healthcare provider. And that is something that we as an industry need to resolve and make more transparent to the consumer. Next slide, please. So our guiding principles, I mentioned the patient-friendly billing. Our guiding principles that still remain today is clear communication. Our patients should be able to understand and determine what to do with the communication at hand. It needs to be concise. The statement should contain just the right amount of detail. And one thing that we've wanted our patient statements to be would be not only a request for payment, a statement of account, but we also sought to educate the public and make the purchasing of healthcare services more transparent to the extent that we could. Correct, this goes without saying. Patient statements should be correct, not contain estimates of liabilities or errors. We go through great lengths at Geisinger to ensure that the amount we request from a patient agrees to that amount his or her insurance determined to be owed by the patient. And again, needs to be presented in terms the average person can understand. Not an easy task, considering that insurance companies are sending our patients explanation of benefits that vary in nomenclature to what the hospital or the physician may be calling the same event. And again, as I stated before, it should contain a section on frequently asked questions. We use the document to communicate and educate, and also a way to bring in our customer for additional information if the documentation in front of them does not provide it. Next slide, please. So our patient statement should be a broader strategy on patient communication. We look at pre-service patient estimates. We're actually looking to honor our estimate. Existing today, our estimate has a disclaimer that depending on the procedure that is performed, that estimate, the actual may be larger or smaller than the estimate. We are looking to change that and honor our estimate to the best of our ability. We're looking to also outline the provider and the location of service and clearly outline the patient liability. Our challenges, and there is a lot of similarity here with Integris and probably with lots of people on the call. Our challenge is how to integrate and make it seamless so that the insurance processing is easily understood by the consumer, as well as the healthcare services that were purchased. The desire is to have, the desire of this challenge is to have a national standard that perhaps we can all follow, but I would add that that national standard needs to expand to insurance companies so that we all work in concert and achieve a higher level of understanding across the purchases of insurance. Along with that, we need to expand, payment automation, and not only payment automation, but the distribution of payment in a manner that is in agreement with the patient's intentions for payment and in a manner that the patient can understand and can direct it. Next slide, please.
Thank you, Barbara. Now we'll pass it on to Matt Powell to go over the design challenge resources.
Thank you. This is Paul Kahn from the MadPow team. I just wanted to take a few minutes to familiarize the folks on the call with the resources that we've put together that are available on the Bill Can Understand website. I expect that many of you have already gone through this, but I just wanted to point things out in case you're not aware that we have, as it says here on the slide, sample medical bills, benefit statements, and cost estimators that were collected. We have an extensive research report that contains information from both stakeholder interviews and patient interviews, and a fairly substantial online patient survey that we ran before the site was launched. We created a current state patient journey and an ecosystem map for the current state of medical billing. We gathered, with a lot of help from many participants, guidelines, checklists, regulations that might help you out, as well as some recommended literature and articles. So I'd just like to go through those one at a time. Next slide, please. So on the research report, we had the opportunity to talk with many of the people on the advisory panel, which was a tremendous benefit, as well as interviewing patients, and we came up with a set of top concerns that we thought would be a very good guideline for the types of problems that we think the solution should address. And if you go through that research report, you'll see we've used these icons to indicate for the quotes and ideas that we got in the interviews which ones came from people in insurance companies and health systems, which came from patients, so that would give you some perspective on that. Next slide, please. We gathered examples of existing medical bills. Many of them are from the pilot partners that are on the advisory board. We've got some examples of current bills from Integris, from Geisinger, from Metro Health, and several of the other organizations. We give this to you as examples of the kinds of information that needs to be communicated, and also so you can see the current range of approaches that are being taken by different health systems. Next slide, please. In terms of what we think is good experience design and service design practice, we created an ecosystem diagram. In this case, you've got, I think, 9 different players that a patient will be interacting with when they're going through a health event and they're looking at information having to do with their medical bills, and then we broke those down by different groups of peoples and entities and so forth. And we tried to align them horizontally so that you can see, for example, how many different phone calls they might be getting from different players, or how many different portals they might be accessing. Next slide. And then we also took a very realistic example of someone having a health event, and we created a fairly detailed patient journey map. This is just a little snapshot of a rather large map where we tried to combine both the experience that the patient had of the health event along with the interactions that they're having both with their providers and with their payers, and then traced out the 3, 4, 5, 6-month journey of receiving bills for different things that had happened 2 months before or 4 months before. Next slide, please. We also gathered what we think are good guidelines and literature for you to refer to. There's a good set of guidelines on human-centered design. There's a very important set of guidelines on clear communication in medical billing that is a result of a task force that's been working on this for several years. And we also tried to find what we thought would be the most helpful current literature identifying what some of the pain points are to different players within the industry in medical billing. So that's a summary of what we put together, and I hope everyone will take the opportunity to go through that as you're considering the challenge and coming up with your solutions. Thanks very much.
Thanks, Paul. So the submission requirements for this challenge include 4 main components. Participants must submit a written design brief that describes the concept, the design principles it follows, and how it meets the evaluation criteria listed on the challenge website. A brief video also must be submitted. The video should describe the proposed concept, the design principles it follows, and how it meets the evaluation criteria. Thirdly, the submission includes a visual composition of the tools and materials the patient may see and interact with, including the medical bill itself. Lastly, participants will submit a journey map that illustrates changes to the medical billing process from the patient's perspective in terms of his or her specific experience and what solutions are provided by the healthcare organizations involved. By pre-registering, you will receive the final application form via email, which prompts applicants to provide the design brief, the video, visual composition, and journey map. You can apply for Prize 1, Prize 2, or both using this final application form. If you apply to both prizes, you will be prompted to provide 2 of each item in the submission criteria. Now I'll pass it to Amy to walk through the evaluation criteria.
Thanks, Alex. So every submission needs to consider the core criteria, which includes most appropriate use of information and data. So on the background page of the website are many, many resources that Paul just took you through. One of them is a listing of some of the information and data that may appear on the bills. You also have a subset of bills that you can look at for what information and data is on there. And you may find that there's some information and data that should be on the bill that isn't found in any of the resources we provided. So it's at your discretion to decide what should be on the bill, what's the most appropriate information at what time, based upon the resources we've provided, your own research and investigation, what we included from patients in the research report, what you may discover from talking with patients, or even your own personal experience. So when we're looking at this, we're going to say, okay, we're going to evaluate it from the perspective of, is the patient getting the right information at the right time? And so that's that first item there. And then the next one about addressing top concerns. Paul mentioned the research report. Top concerns are listed there and detailed there. We want to make sure that all of the submissions are addressing these top concerns, but we don't want to limit you to those top concerns. There may be other things that you want to account for as well, but we want to make sure that those base concerns are addressed. And then looking at usefulness and understandability, everything that the patient sees should of course make sense to them. So this includes the medical bill as well as anything else that you design that the patient will see along the way. And we've provided resources for that as well. There are some guidelines that you can follow around a clear communication checklist that the HHS Health Literacy Work Group has provided. So we're going to be looking at the submissions within the context of those guidelines. And we encourage you, we wanted to give you as much information as we could so that you could get up to speed quickly in some of the challenges and opportunities in this space. But we encourage you to use a human-centered design process. And human-centered design, of course, means involving the people who will be affected by the solutions we create in the process of creating them. So in this case, it may be patients, it may be their families, it may be people in the health system. So definitely talking with them, running things by them, designing with them, validating with them. We've provided a process on the background page in case you want to get up to speed in human-centered design or get some ideas there for a process that you can use. Please refer to that. I did mention plain language. Please consider literacy levels and simple plain language in the things that you create. We know that many things that patients see have legal information on them, so figuring out how to deal with that in an effective way is part of it, but making sure that everything is as understandable as possible to the majority of folks. And then finally, uniqueness and creativity of the solution. There really isn't a resource that can guide us along these lines, but it really is, we're looking for something that stands out, something that took a really different approach and one that will kind of guide us in the right direction. So that's the core criteria for every submission, but then we kind of branch off. And there are two different prizes. One is for the easiest bill to understand. So that's, bills are delivered digitally, they're delivered in the mail, and that's not going to go away for a while, even if we reinvent a new process. So how do we make the bills, the things that the patient sees, easier to understand? And that's really going to be how we're judging prize one. So we're going to be looking at submissions that address the issues and opportunities associated with the bill design itself. So that's what data is there, what information is there, how is it presented, the information design, the aesthetic, and all of that. The accuracy of the data certainly is important, but that's not something that we can necessarily reflect in the design. But then there's also incremental innovation. So how do we kind of step forward? How do we take what exists and make it better? Not necessarily designing something that's 10 years out, but taking us, again, a step in the right direction. So prize one is really focused on the bill itself and making some good improvements to that bill. Whereas, next slide, please. Whereas prize two is focused on more future forward innovation, a transformational approach. And in this approach, maybe there's a bill, maybe there's not a bill. We're looking at the entire experience from the point where somebody is evaluating different treatments and their costs and coming to understand the costs to the point where they get care, to the point where they're billed, but maybe in a new process there wouldn't even be a bill. So how do we leverage models from other industries or a new model to solve for this so that people aren't getting surprise bills and they're understanding their insurance and what happens to them along the way throughout their experience. So again, we're looking for issues and opportunities associated with the journey to be addressed for prize two. Alignment with modern consumer expectations. So people are coming to the health system having been to restaurants, having used Amazon, having used many modern tools, and then integrating with the health system that works in a very different way. So how do we apply that here and really look at the workflow, the data, the technology, and evolve the existing model? So this is where we're really looking to kind of disrupt things and see where we can take it future forward. Now, you can submit for this prize and have a bill. In some situations, even in a future forward approach, there may still be a bill, so you may submit a bill. And and that might make you eligible for prize one as well. So you can decide which direction you want to head.
Thanks, Amy. Winners of this challenge will receive recognition and prizes. They will draw national attention across the health ecosystem, be promoted through both Health 2.0 and MadPows networks, and may have the opportunity to work with healthcare organizations involved in the challenge to implement their concepts. In terms of timing, the application closes on August 10th, 2016 at 11:59 p.m. Eastern Time, and the judging period will begin. The winners will be announced at the 10th Annual Health 2.0 Fall Conference at the end of September. There is up to $10,000 in cash prizes available to winners. There are two prizes, one for the easiest bill to understand and one for the transformational approach. Honorable mentions will also be recognized for demonstrating a compelling concept or solution. So at this point, we'll open up the webinar to questions from participants. So please type your questions into the GoToWebinar control panel question window. The first question, which I think would be for MadPow, is the design agency a judge? What is their role?
So the judging process will be in multiple steps. First, we're going to weed out, any that do not meet the criteria at all, and then we're going to put it to the advisory panel. The advisory panel is made up of HHS, AARP, MadPow, and the pilot partners including Geisinger, Cambia, Integris, and some others. So we're going to evaluate each submission from the perspective of how does it meet the evaluation criteria. Then we're going to make recommendations and notes around which ones we think are bubbling to the top. The submissions will then be reviewed by some patients and caregivers. We're looking to set that up. And then it will go to judges that are from the government, federal folks who will be making the final call. So when MadPow is involved in the advisory, we're really going to be weighing in from the design perspective and from the perspective that we did all the research and we kind of heard what patients said and wrote up the report. So we'll be taking kind of the human-centered design lens when we're participating in judging.
Great, thank you, Amy. This is a question for the whole panel. Maybe MadPow can start and then HHS can follow up. Can you speak a little bit about how the gap in the linkage with insurance companies can be potentially addressed in this medical bill challenge, since it seems like a critical piece of the puzzle?
It's absolutely a critical piece. Right now, patients receive bills and they receive EOBs, explanations of benefits, and it's very confusing because you might get the bill and then the EOB, and you don't know if you've received everything, and it's hard to piece them together. In the first prize, we'll just be looking at the medical bill. If the medical bill is redesigned considering the way the system is right now and is fundamentally improved, that would be a good thing. It's still regulated that people will have to receive EOBs, but in the transformational approach, we can look at a world where the patient receives something different, their experience is different, and maybe an EOB isn't required because the health insurance company and the health system have done something behind the scenes to work it out such that the patient doesn't have to receive both materials. Again, and maybe they don't even receive a bill or EOB in the end. So in the transformational approach, we can really look at disrupting current models and creating something that's new and makes sense.
Great, thank you, Amy. And I was wondering if Barbara or Greg have anything to add.
This is Barbara Tapscott. That is certainly one of the areas that we are looking at Geisinger. one of the things that remains a challenge for us is create that linkage between our own health plan and what we provide on a statement to patients. And like you said, there are instances where patients do not receive a bill for certain services because the health plan may cover them at 100%. And part of today's answer is we don't present a bill to a patient if there is no patient liability. One of the things that we're evaluating is, should we present a bill as a mean for the patient to establish that linkage? It certainly is a pressing challenge for the industry.
I would agree. I think a big part of this also is timing. Hospital and health system billing systems are used to dropping bills at specific points in time, and that never really matches up with the way insurance companies may process a claim. So there's always things in flux, and patients have things done or are going to have things done at a different sequence, and they get the bills back from the insurance companies, and it creates a real dilemma. So I think if the innovative billing process can crack the timing nut, I think that would be a huge, huge step forward.
Thank you, Greg. The next question is, will the video and journey map components be required even if the team only intends to submit for award number 1, the most readable bill? So I can answer that question quickly, and maybe Amy at MadPow wants to chime in. The video and journey map are definitely required components, 2 out of the 4 required components that you will need to submit an application for both Prize 1 and Prize 2.
Right, and if you're focusing your efforts on the design of the bill itself, perhaps you don't fundamentally alter the journey map. Perhaps you make some minor alterations. But some of the things that end up being a problem on the bill are the result of the journey kind of leading up to it. So just to consider it and perhaps minorly alter it.
Thanks, Amy. And similarly, the next question related to the submission, is the use of human-centered design process required, or can a different process be used without impacting the evaluation of the submission?
I'll take that. I mean, really, what we're looking for is for folks not to go off in a vacuum and design something. So to include real people other than the team itself in the evaluation is what we're looking for, because we think it will increase quality. So we are looking for people to use human-centered design process, and it could be speaking with a few people, it could be speaking with several people, but again, yes, to reflect what process has been used in the submission and describe that is a requirement. There are many, many different processes, but the point here is to make sure that some validation of ideas has taken place and some including real people has taken place. Even experts forget that they know things that normal people don't know. And so that's why it's really good to get normal people, quote unquote, involved in the process.
Thanks, Amy. The next question that I think would be helpful if Paul or Amy took, and then maybe HHS can add a follow-up. Can you speak a little bit about the content of the submission? So specifically, how would the content of the design brief be different from the video?
From a content perspective, they'll be very similar. The video, it's only 3 minutes, so it's the highlight around here's what we were looking to achieve with our submission. Here are the principles we followed. Those principles were based upon what we learned in our process, and here's why we think that it meets the evaluation criteria. The written aspect is a chance to get a little more lengthy, though not too lengthy, because there is a word limit to that written narrative.
Great, thank you, Amy. The next question that I would like to pose to the panel. There are a lot of players involved in a bill: doctors, hospitals, insurers, software developers, and billers. How are you going to get them to all agree on a standardized format without federal requirements?
I'll give one response. I think what we're looking for is an inspirational design that when people see it and they recognize the value of it and the effectiveness of it, it would attract all the different players to following these guidelines or following this format. That's just speaking for myself. I think that's what we're looking for.
Right, a vision has the potential to unite people and show them what's possible, and people can get excited around a vision, and it can show us, what direction we can head. But it is a great question, and I wonder if HHS wants to weigh in on that as well.
I think we're totally aligned with what Matt Powell has shared, and in terms of our intentions, I think the goal of this is to really start a national conversation about the steps that these players can take collectively to improve the patient experience of the medical billing process. And I think establishing those examples and best practices will help us kind of move the needle on where we should go in terms of a standard. But just given the kind of diversity of the challenges that exist today, as well as the potential solutions, I think that this challenge and the collaborative approach that we're taking together with key players in the healthcare system is the right immediate step.
Hi, this is Jeff from ARP, just chiming in. Sorry I missed my section earlier. It was technical difficulties on my fault. But I think also, too, although I'm at a nonprofit, I think looking at it from an enterprise perspective and an industry perspective, efficiency are efficiencies. And I think if the industry decides that it wants to be more efficient and transparent, it benefits not only the end consumers that are involved in the industry, but also the players within the industry themselves. So I think if we can demonstrate an effective business case as to why more transparency and clarity within billing benefits both sides of the equation, I think it'll be adopted readily, because it actually increases the ability for people to deliver better care and better service, and then also be able to benefit from lower costs of delivering that.
That's right. One more point there is that through the research that we did with stakeholders, we found that they want this to be easier for patients. They don't want people to be calling the insurance company, the health system, upset because they don't understand and they're having to sort this out. They don't want to deliver a poor experience. They want to deliver a good experience, and there are business benefits associated with that as well. But collaboration certainly is difficult, but hopefully, to Sarika's point, this can create a conversation that leads to some real change.
Thanks, Amy. The next question is for HHS. Did HHS conduct the survey of patients and providers that applicants must review? Is addressing the survey's findings a criterion for winning an award?
So this has been at HHS. It was actually MadPow that the folks that are administrating the challenge that circulated an online survey, and they had asked people for feedback on their patient billing experience. And it's meant to provide challenge participants with sort of examples of direct feedback from folks who have gone through the medical billing process. So it's meant to be more of a, not so much a representative sample of this population as direct feedback from folks. And people were asked to include, or participants in the challenge are asked to include patient feedback into their entries, which will end up, as people have previously described, being evaluated on the basis of several criteria, including use of human-centered design, how they use plain language to write up the bill or to explain the medical billing process, and creativity.
Thank you, Ben. The next question for the panel, maybe MadPow can start and then HHS can follow up. Should we look at a solution for making medical billing easier from a healthcare professional's point of view as well?
I'll give a quick answer, and then I'd like to hear what Paul has to say as well. The people who are working in the health system are well aware of the struggles that patients have with regard to billing, especially if a patient asks how much is that going to cost, and the medical personnel can't answer that question, or they just see the anxiety and frustration that patients are experiencing. So they definitely have a perspective in this as well. Paul, what do you think?
I think that what I'm looking for, and I'm just speaking as someone who would be on the advisory panel looking at the results, is a solution that does take into account the perspective primarily of the patients. I mean, looks at it from the patient's point of view, but also through research and through evaluation of the resources that you have available to you, understand the problems and issues that are faced by the payers and the providers. I think that the research that we did in talking with the pilot partners and various other people in the industry gave a very clear picture that everyone wants to solve this problem. And so a solution that's going to work is a solution that will work for everyone, for everyone in the entire industry.
Thank you, Paul. The next question is, can one entity win both awards? So the answer to this question is applicants can choose to apply to both Prize 1 and Prize 2. If they do, they will need to submit an entry for each category. So as we explained earlier, in the pre-registration process, you pre-register and you receive a link to the final application form. People that submit the final application form are the only people that will be eligible for these challenges, for this challenge. And if you do intend to apply to both Prize 1 and Prize 2, the final application form will prompt you to provide submissions for all of those 4 main components for both prizes. The next question, I'm thinking that MadPow may be able to take this. This person is not particularly familiar with a journey map. Can you give a little bit more information as to what you are expecting for this submission?
Yeah, let me take that. I would suggest that they simply do a search through service design and experience design resources online for a customer journey map, and they will see a lot of resources. They'll see a wide variety of approaches to this. There's a recent book that was published called Mapping Experiences, I believe, that was just published by O'Reilly, that has dozens of different examples in there. So what we're looking for is described in the literature for the profession. And we've given you an example, but that's simply an example of one approach, and there's many different approaches to doing this.
Also, just at the high level, a journey is from the patient's perspective. What steps are they taking? What are they seeing, feeling, thinking, and doing? What is their intention? What are their tasks to be done? And what's going on behind the scenes at the health system or the insurance company? Because again, what the patient sees and does may be the result of a policy at the health insurance company, or something happened at the health system. And so it's really just weaving together the process, but taking it from the patient's perspective, understanding what they may want and what we may want to deliver as a result of what they want and need.
Thanks, Amy. The next question to the panel, I think that maybe HHS can take this, and then MadPow. What exactly does it mean to be a collaborator? Can you explain a little bit about the roles of HHS and MadPow and AARP partnering in this challenge?
Sure, I'll jump in and take that one. So HHS and MadPow are partnering as the challenge collaborators who have helped to develop this design concept and the challenge concept and move it to launch. And AARP is financially sponsoring the challenge, and the 6 health organizations we have committed to test or implement the winning solutions for the patients that they serve, and that includes Geisinger and Integris, for Greg and Barbara, who are representatives of those organizations on this call. And then AARP, MadPow, and these 6 health organizations will each have a representative on this advisory panel, and that advisory panel will provide technical advice to HHS judges who will make the final selection of the winning entries in September.
Thank you, Ben. The next question, are you addressing transparency in medical costs before a consumer gets a service? Isn't that part of the problem?
I'll take this. It absolutely is part of the problem, in that there's, many things are recommended to patients that, may not be the best thing for them, and they're trying to figure out what's right for them, and really their interest is the best health possible, and costs might not come up at the time, and so it's really difficult to balance the reality of cost considerations with the seriousness and emotionality associated with health decisions. And so when somebody is in the thick of it, planning and deciding, and things are coming up, that's really, it is a point where they need some support here, because at the end of it, they might get a medical bill that's unexpected or higher than expected, and it may include things that, they could have gone another route and could have been avoided.
Thanks, Amy. I think we have time for one more question. So this question is a little bit about the challenge audience. So based on the presentation, it appears that aging Americans might be a priority demographic for this challenge. Is this true, or should we consider all demographic audiences to be equally important, because a solution designed primarily for people 60 years old or older may be quite different than a solution designed for younger audiences?
This is a great question, and the challenge is meant to address every American, but our aging population is facing this, and it's a real point of confusion, which is why AARP came to the table and wanted to fund this challenge and make it a reality. We would encourage participants to look at all ends of the spectrum, from pediatric to chronic condition management to acute episodes to and all of it, but then to focus on perhaps one journey. And we provided one patient and one journey as an example, knowing that there is a multitude of journeys that can take place, really an endless number of variations that can take place in terms of what type of patient, what is their journey, what goes right along the way, what goes wrong along the way. So we'd encourage you to consider the struggles that different types of folks can have in different types of situations, but then also to focus on one and use that to kind of express your ideas. So yes, it's not exclusive to aging Americans, though it may be helpful to pick a certain segment to run with.
If I may, this is Jeff with AARP. I think I would fortify what Amy's saying, but also I think that good design principles that would be applicable and accessible to people that are aging would also be accessible to people in other demographics. And so I think if there is a clean and clear way of presenting information, it would be relevant both to people as they age, and to Amy's point, the bulk of healthcare resources are consumed by people over 65, but at the same time, I think that principles that might be relevant and make the information presentation clear to people as they age would also be clear to people that are younger on the age curve. And also, I think at the same time, there are people that are aging that are caring for people of all different demographics. So there are grandparents taking care of children, grandchildren, and adult children taking care of both grandparents and their children at the same time. So I think there has to be some design principles that would be universal to each of these demographics, I think, that could be presented within the challenge.
Thank you, Jeff. And with that, I'd like to close out our Q&A for today.